Hello everybody, I am Dr. Haseeb Hassan, consultant neurologist and epilepsy expert at MRI Hospital, Mukundapur, Kolkata. Today we will be discussing regarding epilepsy and mainly epilepsy surgery. So epilepsy is a disease which is primarily treated by medicines, but around 30% of patients of epilepsy might not get cure or control on medication. So these are known as medically refractory epilepsy or drug resistant epilepsy. So in these patients, we have to explore the alternative option. One of these options are epilepsy surgery. Epilepsy surgery are basically of two types. One which is done with curative intent is known as focal receptive surgery. Means a focus of the brain, a focus which is producing seizure is taken out. So how we determine this focus is mainly based on investigations. If MRI shows there is a part of the brain which is defective or has lesion which is producing seizure, and EG, and when we do video EG we record seizure and find that these seizures are all originating from that area or around that area, and if we take out that area by doing either surgery or by thermoablation, seizure can be controlled. Then these are taken for what is known as focal receptive surgery, and which can make the patient seizure freedom and even many of them out of medication, and success rate is around 70%. Whereas these patients who have failed medication in initial stage keep on taking medication, chances they subsequently become seizure free and sustain that is only 5%. So those patients who are not getting adequately control on seizure must consult an epilepsy expert to explore the option of epilepsy surgery. Unfortunately, all those patients might not be eligible for curative epilepsy surgery. So then we see the option of what we call as palliative epilepsy surgery. Means we try to reduce the seizure burden by either decreasing the number or disability. Suppose a patient is having seizure and with every seizure he falls down. If we are able to control his falls, his obviously risk will come much lower, though he might be experiencing some seizures here and there. Unfortunately, all refractory patients might not be eligible for curative epilepsy surgery, and we might have to explore the option of palliative surgery. Means we are doing the surgery with the intent of reducing the seizure burden, disability related to seizure, but we will not be able to abolish it completely. So either that can be done by external device known as deep brain stimulation, which is pacemaker of the brain, or vagus nerve stimulation, where the implant is put over here and this externally modulates the brain. Or we can do surgery known as corpus callosum, where the brain is split into two parts, where seizure from one part of the brain do not go to other part and falls can be prevented. There are certain group of patients who will not be eligible for even this kind of treatment category, and there we might have to go back to medicine and look at what best we can give to the patient, and we might have to explore the option of ketogenic diet or other treatment modality. I hope that this video will help those patients and family members who are trying to seek treatment for their near and dear one where their medical management epilepsy has failed. So don't hesitate to consult an epilepsy expert and explore the option of epilepsy surgery, which can be best possible option for medically refractory epilepsy if the patient is otherwise eligible for that. Thank you very much for patience hearing.